For more, we have former Manitoba Chief Medical Officer of Health and University of Manitoba Professor Joel Kettner. Welcome, Dr. Kettner. Thanks so much for joining us.
Hello.
Cases in Canada are on the decline. So is this warning from the CMA justified?
Well, I don't know if warning's the word I would use, but certainly the issues raised in the CMA statement are all important. They're all important issues, and I think it'll be a stimulus for more discussion and maybe debate on exactly how to achieve what the CMA appropriately is calling for, which is minimize to the degree we can a second wave and reduce the impacts of the virus now and in the future, especially on those who are most susceptible and marginalized. Make sure our healthcare workers are best equipped to do their job and to be protected. These are all important things. The testing question is interesting, and I think it remains a bit controversial as to what is the best way to do testing and contact tracing under the circumstances. And so we could talk about that more, but it's not entirely clear to me what's being suggested. If it's sort of massive testing of people that have no symptoms, I don't think the evidence is very strong for how that will help. But in certain circumstances, I think more testing would be appropriate.
How does the summer season and the eventual move into fall and winter play into how a second wave could come about?
Well, we know that as people gather more together in indoor spaces, which is true in the wintertime, that's probably one of the reasons we have our flu seasons and other increase of respiratory illness. So I think we have to anticipate that. And more indoor time at schools, et cetera. But I think what we also need to think about is what is often called a risk-based analysis. So instead of only thinking about reducing the spread of the virus amongst the whole of our population and society, we recognize, especially with this virus, that's actually quite a small proportion of the population that are at highest risk for severe illness, hospitalization, and death. So a risk-based strategy would maybe help us focus more on how to protect those at highest risk and maybe allow more freedom of everyday life to those who are much lower risk for severe illness and death. And I think this is a challenge now that it's time to focus on now that we're out of a more lockdown situation.
Finding that balance. Do you predict a sharp second wave, or, like the CMA president has put it, little bumps here and there, I believe is what he said?
Well, predicting the future, especially of viruses, is difficult and probably not wise. If we think of the patterns we have seen, say, of influenza, I mean, influenza does occur all year round. We get cases of it, and if we test for it, we see even more of it. It does have its upsurge, usually, in the sort of December to March period. But I think we could probably expect from just what we're seeing, which is cases will continue. I think most people would be surprised if they stopped altogether, and that an elimination strategy is not really appropriate and would be not only effective, but would cause even more of the harms we've seen in the social and economic factors from this strategy of the last few months, not to mention the impact on healthcare in general for services that people have been delayed. So I think it'll probably just continue. It's very important to not think that it's going to go away. Whether it comes in waves or focused outbreaks, et cetera, I think is maybe less important. To just be ready, monitor it, and make sure that the measures are appropriate and not any more than necessary to reduce the risk of those who will get severe infections or die, and not overimpose on everyday life for our social functions.
Don't let our guard down just yet. Dr. Joel Kettner, thank you so much for joining us.